You know, virtual reality is set to totally shake up how we test our vision. It's promising this incredible future where we ditch all those large, clunky machines we're so used to. But behind all that excitement, there's a really important story about precision and safety that, frankly, you need to hear.
And you can totally see the appeal, right? Instead of that big, stationary, clinical perimeters, you just imagine putting on a lightweight VR headset. I mean, this makes eye exams portable, way more comfortable, and it's basically perfect for telemedicine. Sounds like a win-win for everyone involved.
But that brings us to the million-dollar question. These devices are amazing pieces of tech, but most of them were built for gaming, for entertainment, not for high-stakes medical diagnoses. So, can a gadget designed to put you in a fantasy world really be trusted to catch the very first signs of diseases that could steal your sight, like glaucoma? Well, that's exactly what we're going to dig into.
Okay, so first, let's just get into why everyone is so hyped about this. The potential benefits really could be game-changing for eye care.
I mean, studies are already showing that patients just find VR tests more comfortable. The headsets are portable, which opens up this whole world of remote care and at-home monitoring. The immersive design cuts out all the distractions, and some tests can even be done faster. It's pretty easy to see why VR feels like the future.
But here's the thing. Here's the catch. The actual hardware inside these headsets, it wasn't engineered for clinical precision. And that one simple fact creates some really serious and often hidden limitations. And it all starts with the screen itself.
And that brings us to what we're calling the 8-bit screen trap. This is probably one of the biggest yet least discussed bottlenecks in this whole technology, and it's all about how many different shades of light the screen can actually produce. So, the clinical gold standard, the big machine in the hospital, it has an incredibly high dynamic resolution. It can create these super subtle, super precise changes in light. But on the other hand, most VR headsets, they use 8-bit LCD screens. That means they can only show 256 distinct levels of brightness. Now, 256 might sound like a lot, but for perimetry, which is all about testing your peripheral vision, it's a massive limitation.
And this image just shows it all, doesn't it? On the left, you've got that smooth, continuous gradient you get from the Goldman standard. But look at the right. You can see these chunky, blocky steps from the 8-bit screen. For several different light levels the gold standard can create, the VR screen is just stuck showing the exact same block of gray.
And listen, this isn't just a visual quirk. It has real-world consequences. The research is very clear. It points to an inability to meet ISO stimulus contrast accuracy requirements above approximately 25 decibels. ISO is the International Organization for Standardization. So in plain English, the device is failing to meet the required international standard for precision where it matters most.
And here is the absolute kicker. That zone of inaccuracy, above 25 decibels, and we're talking light sensitivity here, not sound, that is the exact range where eye doctors look for the faintest, earliest signs of glaucoma damage. The very thing VR perimetry is supposed to catch is the very thing its screen might be physically unable to show accurately. That creates a huge risk of false negatives, of missing a diagnosis altogether.
And this problem actually leads us right into the next big issue, the massive difference in raw brightness the devices can produce. This is called the dynamic range. So that clinical perimeters, our gold standard, can produce a maximum brightness of over 3,000 candelas per meter squared. It's that sheer power that allows it to test the full, complete range of a patient's vision. Now, let's compare that to your typical consumer VR headset. It tops out at around 100 candelas per meter squared. That is an enormous gap. The headset just doesn't have the horsepower to create the brightest lights needed for a proper clinical test.
So what does this actually mean for a patient? Well, because of this power limit, the effective measurement floor for a lot of these VR devices is right around 15 decibels. They physically can't test for vision loss that's more severe than that, which means they could be hiding the true extent of someone's condition.
Notice the variance on these Deming regression charts from the study. In a perfect one-to-one match between the VR headset and the big clinical machine, all those blue dots would sit exactly on that dashed identity line. But as you can see, as the visual field gets worse, moving toward the left side of the chart, the data just spreads out wildly. This happens because the VR device hits that 15 decibel measurement floor we just talked about. When the algorithm tries to estimate sensitivity near this floor, the uncertainty and the variance completely skyrocket. It physically struggles to hone in on the true sensitivity value because it simply lacks the hardware range.
Now, here is the absolute most crucial takeaway. If you only read the study's headline, you're going to see a mean deviation correlation of R equals 0.94. Wow, sounds phenomenal, right? But a high correlation really just means the two variables are moving in the same general direction. To understand true accuracy, you have to look at the regression slope. And the NOVA trial reveals a regression slope of only 0.48, with an intercept of negative 2.08 decibels. A perfect match would be a slope of 1.0. A slope of 0.48? That means the VR device is capturing less than half of the true visual defect severity compared to the gold standard.
So you're probably wondering, can't the device makers just fix this? Well, people are trying, but the solutions they've come up with have their own major trade-offs.
Okay, so the most common workaround is something called the mesopic fix. To get around the fact that the screen isn't very bright, designers just lower the background brightness inside the headset. This makes the test stimuli appear brighter by comparison, and it expands the measurement range.
But, and this is a huge but, there's a big trade-off. Standard perimetry is phototopic, which means it's done in bright conditions that test only your eye's cone cells, your daytime vision. By dimming the background, VR devices shift into the mesopic range, which is more like twilight. This activates both your rods and your cones. So sure, you gain some testing range, but you're now testing a completely different visual system, and that makes it almost impossible to compare results to the gold standard or accurately track if a disease is getting worse over time.
And on top of all that, you have other hardware issues. Things like the Fresnel lenses that are used in a lot of headsets. They can create their own problems. We're talking glare, weird distortions, and reduced contrast. All things that can throw off the accuracy of a vision test.
Okay, so let's bring this all together. Let's put the tech talk aside for a second. Why do all these details matter so much for an actual patient sitting in a doctor's office? Here's the bottom line. First, you've got the 8-bit trap, which creates a blind spot where the earliest hints of a disease can just be completely missed. Then, there's a dynamic range gap, which means the severity of damage that's already there can be dangerously underestimated. And finally, those so-called fixes end up testing a different visual system, making it incredibly hard to tell if a patient's vision is actually getting worse over time. These are not minor issues.
So, what's the solution? Well, as one expert put it, the path forward is pretty clear. We need to stop trying to force consumer gaming devices to do a doctor's job. The real answer is to develop virtual reality headsets specifically designed for vision testing. We need purpose-built medical hardware that's designed from the ground up to get this right.
Look, there is no doubt that VR has the potential to make eye care better, more accessible, and way more patient-friendly. But we have to ask ourselves, is our excitement for cool, off-the-shelf tech getting ahead of the hard science of clinical reliability? And maybe the most important question of all is, what's the risk to patients if the answer to that question is yes?